Imagine opening your medicine cabinet and realizing that the very pills you take to stay healthy might be quietly working against you. It sounds counterintuitive, even unfair, but new research shows that some of the most commonly prescribed medications may be affecting your sexual health, specifically your ability to get or maintain an erection. As a urologist and pelvic surgeon, I often see men who come in worried that something is wrong with their bodies, only to discover that the issue might be sitting in a small orange bottle on their bathroom shelf. The connection between medications and erectile dysfunction, ED, isn't widely discussed, and many men suffer in silence, assuming it's simply a part of aging or stress. But in truth, what's happening is far more nuanced, and importantly, it's something we can often address once we understand what's going on. To understand how medications can interfere with erections, we first need to understand how erections actually work. It's a complex process that relies on three key systems working in perfect harmony: the cardiovascular system, the nervous system, and the endocrine hormonal system. When something or someone excites you, your brain sends signals through the spinal cord and peripheral nerves to the penis, triggering the release of nitric oxide. This powerful molecule relaxes blood vessels, allowing blood to flow rapidly into the spongy erectile tissues. That blood becomes trapped, the penis firms, and an erection occurs. It's a beautifully coordinated biological event, one that depends on healthy blood flow, responsive nerves, and balanced hormones. The problem arises when medications designed to treat other health conditions interfere with one or more of these systems. Some drugs constrict blood vessels or alter how your body regulates blood pressure, reducing the amount of blood that can reach the penis. Others affect nerve signaling, dulling the communication between brain and body. Still, others may change hormonal balance, particularly testosterone levels, which are crucial for libido and the physiological response to arousal. So while you might be taking medication to lower your cholesterol or manage your blood pressure, essential steps for protecting your heart, those same treatments can sometimes make sexual function more difficult. This isn't a small issue. Studies show that nearly 60% of men in the United States have taken at least one prescription medication in the last month, and about 1 in 5 men take 5 or more. That means millions could be dealing with sexual side effects without realizing the cause. A large analysis from the National Health and Nutrition Examination Survey, an NHS, involving over 3,000 men, found that those taking prescription medications were about 80% more likely to experience erectile dysfunction compared to men who weren't. What makes this study especially compelling is that even after accounting for other risk factors like body weight, diabetes, and smoking, the link between medication use and ED persisted. Researchers went a step further by applying a genetic method known as Mendelian randomization, which helps separate cause from correlation, suggesting these medications may not just be associated with ED, but could actually be contributing to it. Of course, not all medications carry this risk, and for many people, their benefits far outweigh the potential downsides. But awareness is key. Once you understand the why, it becomes much easier to have a conversation with your doctor about your symptoms and possible alternatives. For instance, some medications used to control blood pressure, such as beta blockers, are incredibly effective, but can also make it harder for blood vessels in the penis to relax, reducing erectile response. Others, like statins used for cholesterol, can influence testosterone levels indirectly because cholesterol itself is a building block for sex hormones. Even over-the-counter drugs like aspirin, often taken daily for heart health, have been linked to subtle changes in nitric oxide activity, the very molecule essential for initiating an erection. But before you feel alarmed, it's important to keep perspective. The conditions these medications treat, high blood pressure, high cholesterol, diabetes, are themselves major causes of erectile dysfunction if left unmanaged. Uncontrolled diabetes can damage nerves and blood vessels permanently, and untreated high blood pressure can lead to strokes and heart disease, both of which carry far greater risks than ED. In other words, these medications are saving lives, but they also remind us that our health systems are interconnected. As I often tell my patients, sexual function is like a barometer for overall health. When something affects your ability to get or maintain an erection, it's rarely just about the penis. It's often your body's way of signaling that something deeper, cardiovascular, metabolic, or hormonal, needs attention. By learning how medications fit into that puzzle, you can take a proactive role in your health rather than feeling powerless. In the next chapter, we'll dive deeper into the science behind these medications, exploring exactly how they affect your body, which ones are most likely to contribute to ED, and what you can do about it, because you deserve to feel well both in your heart and in your intimate life without having to choose between one and the other. When we talk about erectile dysfunction, most people immediately think of aging, stress, or underlying medical conditions like diabetes or heart disease. And while those factors certainly play a role, the impact of medications is often overlooked. Yet it's one of the most common and surprisingly under-discussed contributors. The truth is that several everyday medications can alter the delicate physiological balance required for a healthy sexual response. In this chapter, let's take a deeper look at how these medications actually work inside your body, why they might interfere with sexual function, and what options exist for managing this side effect without sacrificing your overall health. Let's start with beta blockers, a class of drugs commonly prescribed for high blood pressure, heart disease, and sometimes even anxiety. Atenol is one of the best known examples. Beta blockers work by slowing your heart rate and reducing the workload on your cardiovascular system. In other words, they help keep your blood pressure in check and your heart from working too hard. The problem is that this same mechanism also dampens the activity of the sympathetic nervous system, which plays an important role in sexual arousal. During arousal, your body relies on a surge of sympathetic activity to signal dilation of blood vessels in the penis, allowing for increased blood flow. When beta blockers interfere with that process, the result can be a weaker or more difficult erection. Studies suggest that up to 1 in 4 men taking beta blockers experience some level of erectile dysfunction. For many, this is a frustrating trade-off, protecting the heart but compromising sexual confidence. Next on the list are statins, such as simvastatin and atorvastatin, which are among the most widely prescribed medications in the world. They work by lowering cholesterol, an essential step in preventing heart attacks and strokes. However, cholesterol isn't all bad. It serves as a precursor for many hormones, including testosterone. When cholesterol levels drop significantly, testosterone production can also decline, particularly at higher statin doses. Low testosterone or hypogonadism can lead to reduced libido, fatigue, and difficulty maintaining erections. It's important to note that not everyone who takes statins will experience these effects. Most men tolerate them well. But if you notice a change in your sexual health after starting a statin, it's worth bringing up with your doctor. A simple blood test can check your testosterone levels and help guide next steps. Sometimes adjusting the dose or switching to a different statin formulation can make all the difference. One of the more surprising culprits is aspirin. Yes, the same over-the-counter medication that millions of people take daily for heart protection. While aspirin's benefits in preventing heart attacks and strokes are well established, long-term use has been linked in some studies to an increased risk of erectile dysfunction. The mechanism isn't entirely clear, but researchers suspect it has to do with the way aspirin affects nitric oxide pathways. Nitric oxide is the key molecule that triggers the relaxation of blood vessels during arousal. If its production or function is disrupted, blood flow to the penis can be compromised. Still, this doesn't mean that everyone on aspirin will develop ED. In many cases, the cardiovascular benefits far outweigh the risk. But if you're noticing new or worsening sexual symptoms while taking daily aspirin, it's worth discussing whether you still need it or if alternative strategies could offer the same cardiovascular protection. Now let's talk about one of the most commonly prescribed drugs for diabetes, metformin. This medication helps control blood sugar by improving the body's sensitivity to insulin and reducing glucose production in the liver. It's incredibly effective and has been life-changing for millions of people with type 2 diabetes. However, research has shown that metformin can lower vitamin B12 levels over time. This matters because B12 plays a vital role in nerve health, and healthy nerves are essential for sexual arousal and function. A deficiency can lead to tingling, numbness, and even impaired nerve signaling, all of which can contribute to erectile problems. Metformin may also slightly suppress testosterone production, adding another layer of complexity for men already at risk. The good news is that these effects are often manageable. Checking B12 levels regularly and supplementing when needed can prevent complications. It's easy to feel discouraged when you hear that the very medications protecting your heart or managing your blood sugar could be affecting your sexual health. But it's important to remember that not everyone experiences these side effects, and even when they do occur, they're rarely permanent. The body has an incredible ability to adapt, and there are often safe ways to adjust treatment. For example, if you're taking a beta blocker and notice new sexual symptoms, Your doctor might consider switching you to an AC inhibitor, ARB, two classes of blood pressure medications that tend to have fewer sexual side effects. Similarly, if you're on a statin and struggling with libido or energy, checking testosterone levels and optimizing other factors like exercise, sleep, and stress management can help counteract those changes. Another point worth emphasizing is that ED itself can be both a symptom and a signal. In many cases, erectile dysfunction appears before other signs of cardiovascular disease. The penile arteries are smaller than coronary arteries, so reduced blood flow shows up there first. This is why I often tell my patients that ED is like the canary in the coal mine. It's your body's early warning sign that something in your vascular system needs attention. If you're experiencing ED, even if you suspect it's related to medication, it's essential to use that symptom as motivation to get a thorough cardiovascular check up rather than a reason to ignore it. From a medical standpoint, it's also worth noting that the psychological effects of ED can amplify the problem. Worrying about performance or feeling embarrassed can increase stress and anxiety, which in turn release adrenaline, a hormone that constricts blood vessels and works directly against the mechanisms needed for an erection. This creates a frustrating feedback loop. The key to breaking it often lies in open communication with your partner, your healthcare provider, and yourself. So, what should you do if you suspect your medication might be contributing to erectile dysfunction? The first and most important step is not to stop the medication on your own. Doing so could be dangerous and even life-threatening. Instead, have an honest conversation with your doctor. Explain your symptoms when they started and whether they've changed over time. Bring a list of all medications you're taking, including over the counter drugs and supplements. Often, a small tweak, like changing timing, adjusting the dose, or substituting one medication for another, can make a big difference. In the next chapter, we'll talk about how to take control of your sexual health while staying safe on your medications. We'll discuss strategies for improving sexual function, naturally, lifestyle changes that can support both heart and sexual health, and ways to approach this topic confidently with your healthcare team. Remember, sexual health isn't just about intimacy. It's a vital part of your overall well-being, and it deserves the same care and attention as any other aspect of your health. By now, you've probably realized that when it comes to sexual health, the body doesn't operate in isolation. Every system, cardiovascular, endocrine, neurological, and even psychological, works together in a delicate balance. And when that balance shifts, whether from illness, medication, or lifestyle, sexual function can be one of the first areas to show it. But here's the hopeful truth for most men. Erectile dysfunction linked to medication is manageable, often reversible, and sometimes even preventable with the right approach. The key lies in understanding your body, working closely with your healthcare team, and making lifestyle choices that protect both your heart and your intimacy. The first step is conversation, and I can't emphasize this enough. Many men hesitate to bring up sexual side effects because they feel embarrassed or assume their doctor can't help. In reality, this is one of the most important discussions you can have. As physicians, we can only help with what we know, and we rely on your honesty to guide the next step. If you've noticed changes in your erections after starting a new medication, bring it up at your next visit. There's no judgment, and in most cases, there are practical solutions. Sometimes the fix is as simple as switching to a different drug in the same class. For example, substituting an AC inhibitor for a beta blocker, or adjusting the timing of your dose so that blood levels fluctuate less around the time you're sexually active. Other times, we might consider addressing hormone levels, supplementing vitamins like B12, or working on stress management strategies to reduce the psychological impact of performance anxiety. But beyond the prescription pad, lifestyle plays a massive role in protecting and improving erectile function. Think of lifestyle medicine as the foundation upon which everything else rests. Regular exercise, especially aerobic activity, has been shown to improve blood vessel health, enhance nitric oxide production, and support natural testosterone levels. Even a brisk 30-minute walk most days of the week can make a measurable difference. Diet also matters enormously. Diets rich in fruits, vegetables, lean proteins, and healthy fats, such as the Mediterranean diet, support vascular health and reduce inflammation, both of which directly impact erectile function. Limiting processed foods, sugars, and excessive alcohol can also help maintain stable blood sugar and hormone levels. Sleep, though often overlooked, is another crucial factor. Testosterone levels peak during deep sleep, So poor sleep quality or conditions like sleep apnea can cause hormonal disruption and fatigue that spill over into your sexual health. Managing stress is equally important. Chronic stress keeps the body in a state of elevated cortisol and adrenaline, which constricts blood vessels and suppresses sexual desire. Whether it's through mindfulness therapy or even something as simple as regular relaxation time, stress reduction can dramatically improve both mental and sexual well-being. It's also worth touching on the emotional aspect of erectile dysfunction. Men often describe it as a blow to their confidence, a sign of aging, or a reflection of inadequacy. But it's none of those things. Sexual function is a vital sign, just like blood pressure or heart rate. And when it changes, it's your body's way of asking for attention, not punishment. In fact, I've seen many patients use ED as the turning point to take better care of themselves. One of my favorite parts of being a urologist is watching men make transformative changes after these conversations. They start exercising more, eating better, taking their heart health seriously, and within months, not only does their sexual function improve, but they feel stronger, more energetic, and more confident overall. Another practical point to remember is that medication-induced erectile dysfunction doesn't necessarily mean you'll have to live with it forever. Often, once the underlying health condition, like high blood pressure, high cholesterol, or diabetes, is well controlled and the body's systems begin to recover, erections naturally improve. For some men, medications like PDE5 inhibitors such as sildenafil or tadalafil can provide a temporary bridge, restoring confidence and allowing sexual activity while other health measures take effect. When used under medical supervision, these medications are safe and effective for most men and can be an important part of the treatment plan. What's crucial is to avoid self-blame or secrecy. Erectile dysfunction is incredibly common, and its causes are multifactorial. If your medication plays a role, that's not your fault. It's a side effect, just like fatigue or dizziness might be. The difference is that ED tends to hit us on a more emotional level, and that's why addressing it openly matters so much. Your healthcare provider's goal, and mine, is to help you live a long, fulfilling life that includes a healthy sex life, not one at the expense of the other. As we bring this discussion to a close, I want to leave you with one final thought. Sexual health is a reflection of overall health. When something changes in your sexual function, see it as an opportunity to check in with your body rather than a reason to despair. Ask questions, seek help, and remember that you deserve to feel good in every sense of the word. There is no shame in wanting a satisfying sex life. It's part of being human, and it's deeply connected to emotional intimacy and self-esteem. If you take away one message from this conversation, let it be this: don't suffer in silence. Talk to your doctor. Ask about your medications. Make small but consistent changes to your lifestyle, and most importantly, don't lose hope. I've seen countless patients regain their sexual function, often feeling better than they have in years, once they take that first brave step toward understanding what's happening and taking charge of their health. Because ultimately, being healthy isn't just about living longer, it's about living fully in every way that matters.